I'm Jennifer Braun. I'm with Partners in Prevention of Rock County. This is Amy Hume from Evan I Brake, Brett Grady from Murthy Health Systems, and Wayne Cornwell from the City of Janesville. Our LDA group did a project in conjunction with HealthNet. HealthNet is a local nonprofit that provides medical treatment to the uninsured of Rock County. In this presentation, we're going to give you some information including the statistics from HealthNet, some of their history and their accomplishments, as well as our LDA group's involvement with them. And we're also going to give you an overview of the follow-up survey that we did to assess the effectiveness of our project. HealthNet of Janesville opened in 1994 as the result of a needs assessment that was completed by the Salvation Army the year before that. The assessment identified a lack of affordable health care as one of the major problems in Rock County. HealthNet of Janesville is a free clinic. It serves all of Rock County, and it serves individuals that have no health insurance, Medicare, Medicaid, or medical assistance. Now we're going to show you a brief video about HealthNet presented by former HealthNet Director Tracy Rogers.
Hi, my name is Tracy Rogers, and I'm the Executive Director for HealthNet of Janesville. HealthNet is a grassroots nonprofit free health and dental clinic for the uninsured and low-income residents of Rock County. We do not duplicate any other form of health insurance, so HealthNet serves a vital role for our community by providing the only resource our patients have for primary care. All of our doctors and dentists volunteer their time. With a limited number of staff members, we rely heavily on our volunteers to carry out our mission of providing quality medical care to the community members most in need.
I think it's just something that, as physicians, we feel obligated to do and try to provide as much services as we can to patients. And the patients that we see here have no insurance, have very little income, and I think we end up being the last resort for them to try to get good health care, and that's what we try to provide here.
This means staying alive, basically, to me, because after my stroke, there were certain medications that were essential for me that they provide here. I know I did actually originally thought, oh no, I'm going to go to a free clinic, I'm going to be treated like cattle, and and they're never going to know who I am or anything like that. And it's just the opposite when you get here. These are mostly volunteers, and you think volunteers wouldn't care, but they care more. They care more about people as individuals, and there's no matter how hard a day they're having, it seems like they find some way to smile and look at you, and they have empathy for you, and they take care of you. And I don't know that in years past when I've gone to other clinics or anything that they treat you as well as they do here.
I'm in the boat like other people, lost their job and I needed some help, so I checked them out and they're very good here. They have no insurance and I need my medications and they're here to help me with that.
I worked full-time but in restaurants and they don't offer insurance, and was guided to HealthNet, and I would have been lost, frankly, without them. And they've never ever, that's the biggest thing here, is they've never treated you like less than. And I've seen some pretty frustrating people I would have gotten cranky with here, but they're just always caring. They don't seem to, and maybe it's my thing that I felt ashamed with no insurance, but they never ever, it was just never an issue.
This is no different than a retail pharmacy. There are some patients that are demanding and everything else, but there's more patients that look at you and say thank you, and they mean it. That's really what life is about, to thank you once in a while for doing something, and I'm more than happy to keep doing it. As long as I have the time and the energy, I'm here.
Well, everything that we provide here is either money that we get through grants or different funds, or monies that are given to us. And so it's always a struggle for us to try to have the money to provide the services that patients need for x-rays, for labs, for their medications. Many of the medications are very expensive that they need to take. We do lots of paperwork and put in lots of hours getting medications from the drug companies for the diseases. Some of the medications we end up buying that we need funds for. We need funds for our staff that works here. And the x-rays and laboratory studies that we do all need to be paid for. And so unfortunately it's kind of like a bottomless pit, but we're always looking for new sources and new ways to generate revenue for our office.
We fill over 2,000 prescriptions a month, which is 25,000 probably prescriptions a year. And that has a value, a retail value on it of over $2 million. I mean, it's a lot of money. The reason it's so high is we're able to use many medications direct from the drug companies. They send them to us free. Each one is for a particular patient. We have to do a lot of paperwork, but they send it, and that raises our cost compared to what a normal pharmacy would be. The generics that we buy, we need about $25,000 a year, $25,000 to $30,000 a year to purchase those medications. But then there's all the ancillary costs. We do buy some prescription bottles. We have a computer that we use. We have prescription labels, tape to tape the labels on, all the little things that add up to quite a little money.
Originally, we started planning this clinic in the spring of 2007. There was a large unmet need for low-income patients to receive dental care. They were showing up in the hospitals with swollen faces and being told to go to the dentist, and most of them didn't have an established dentist. So Tracy Rogers approached me and said that there was some funding available to treat them on a as-needed basis. And we started to treat them in our own offices, but we could only had enough funding for one filling a year per patient. So we decided to try and get 20 volunteer dentists together to start up our own clinic, and by doing that we got greater funding. The patients now aren't showing up at the hospital anymore with swollen faces. They're coming to HealthNet Dental to get treated.
We have a gentleman who comes here and has been coming here for a long time. He plays the guitar and sings, has a little group, and once in a while he brings his guitar, sits in the waiting room all morning, plays his guitar, sings. Everybody in the waiting room is singing, we're singing. It's fun. I mean, this is to take people that have so much going against them and to see them smiling and singing. It's just, and it raises everybody's mood that's working that day too.
It seems like we don't accomplish a whole lot for our patients, but in reality, I think they think that we really help them a lot. And every little bit that everybody can do makes a big difference in these patients' lives. And I think that's something we should all try to remember.
I feel very fortunate, very blessed to be able to have this education, this skill, to have a good life, and I want to try and know that I've made a difference in somebody else's life too.
With an increase in volunteer hours and with an increase in public contributions, we're able to serve more people in need. We would not be able to provide our services without the commitment of our partners. They are the foundation for our success.
I hope they survive here. I hope they can find a way to make this continue to work and to accomplish what they're trying to do. There's so many people who've dedicated so much time and money and effort and to make this work, and bless them for that.
You can see HealthNet offers a wide variety of services to fill an unmet need within the Rock County community. The situation when we got involved with HealthNet was that they were at their absolute max capacity. They were only accepting 5 new patients a week. Before that, they had been accepting 30 to 40 new patients per week. So to meet this need, they decided that they needed to expand. They decided to expand the clinic by 40%. So they have doubled the number of exam rooms that they have. They have created a medication dispensing area. They have built a new space for nursing staff and volunteers. They have made major changes to their lighting system, their air conditioner, the walls, the floors. They've added an ADA bathroom, an air handler, and updated the security system. HealthNet has had some major accomplishments. They have provided over 23,000 prescriptions worth an estimated $2 million to prevent healthcare crisis situations in Rock County. They have completed 32% of their treatment plans established at their dental clinic. New patients receive a treatment plan at their first visit, and this plan includes all of the dental services that they're going to need. They've reduced the number of ER visits for 74% of the patients that consider HealthNet their medical home. They've enrolled new patients into the Better Care Core Plus program and increased the number of volunteer hours by 50% over the last 2 years. You can see on this slide some of the services that HealthNet provides to the Rock County community. They do medical and dental care to the uninsured. 84% of HealthNet's revenue comes from donated services and materials. This includes medication, prescription drugs, the time of nurses, pharmacists, doctors, admin costs. And less than 4% of their expenses go to management and fundraising. So most of the revenue is going right back into the services that they're providing for our community. Now Amy will be telling you more about our LDA group's involvement with HealthNet.
Thank you, Jen. Good morning. Our group decided that we wanted to do something that would have a lasting impact on our community. HealthNet was our obvious choice when we learned of their need and their mission. The next slides will walk us through our interactions and involvement with HealthNet. HealthNet was undergoing a renovation to increase the amount of space available for their patient care. As part of the renovation, HealthNet would have one large room for their pharmacy. HealthNet at the time had 5 different rooms for storing their medications. They had an area for their refrigerated medications. They had an area for their donated medications, an area for their patient-stocked medicine. This could be a 1-year supply specific to a patient. They had an area for storing and dispensing their medicine. And finally, they had an area for filled prescriptions waiting to be picked up by their clients. Bringing these areas together would create the need for a new setup. Our group was asked to make recommendations for storing medications based on our research and our interviews. Our objectives were to, 1, research the best practice models for dispensing medications in a non-licensed pharmacy, 2, to develop a plan to organize medications, and lastly, to help implement a medication organization plan. We did research on these 5 different pharmacy settings. It was consistent that all of these pharmacies sorted alphabetically and by type. After our research, our group set up interviews, one with a pharmacist, Mike Dow, one with a volunteer, and one of the nurses. We found that generally a pharmacist enters the orders and a nurse dispenses them. Some of the nurses know medications by brand name, but not their generic name. Currently, it was difficult to locate the meds due to the 5 different rooms. On the left-hand side, you can see our group was interviewing Mike Dow at HealthNet, and then on the right-hand side was just one of the rooms before the renovation. Lastly, I'm going to talk about our interview conclusions. During our interview, we identified that the pharmacists were in favor of storing medications alphabetically and by type. And some of the nurses were in favor of storing medications by class. For example, they would put everything that was an antihistamine in a section, an inhaler in a section, and heart meds, etc. We found the nurses' frustration with medications was largely due to the medications being stored in multiple rooms and not how they were organized. In order to adjust to these changes, you will hear Brett talk more about a formulary. Our final conclusion was the nurses would require orientation and training to the new layout to raise their comfort level. Now, I would like to introduce you to Brett, who will explain our recommendations and our actions.
Thank you, Amy. On this slide, you can see the new big space that was going to be where they took the 5 medication areas and brought them into one. And here are the plans that Mike had drawn up and used to show us at our interview with him. Based on our research and our interviews, we came up with the following conclusions. Firstly, that the medication should be stored by type and then alphabetically, such as Mike suggested and that we found in our research. It's the way that most pharmacies around the world are organized. Secondly, we advocated for a change in process. During one of our interviews, we found out that some of the nurses were writing brand names onto generic bottles of prescriptions. We thought that could be potentially harmful because if they made an error writing on that bottle, then patients could eventually down the line get the wrong medication, which is not a good thing. We also helped by creating a new formulary to add to their existing formulary, which I'll talk about on the next slide. And in addition, our group spent roughly 25 hours helping with medication disposal. When medications expire, they need to be recycled, and when you do that, the cost is by weight. So they asked us to help pop all the pills out of their little blister packs, which, if you've never done it, it's a really, really good experience, don't you think? Finally, we did a follow-up survey to see if the new organization process and tools that we helped create were working for HealthNet. On the left here, you can see the generic formulary that HealthNet had in place. For those of you who don't know what a formulary is, it's basically a list of all the medications that are available at a specific location. So they had a generic formulary where the generic name of the medication is listed by alphabetically on the left, and then there's a brand name also, if in case people know the brand name better than the generic name. To help ease the nurses' fears about organizing the medications alphabetically, if they only knew the brand name, it's hard for them to use this list to find the medication they're looking for. So we helped by creating a new formulary using the same information and put the brand name on the left side alphabetically. So it's easier if you're looking for a brand name to find it on this list. After the expansion, you can see on the left here, this is where their generic bulk meds are stored, and this is their new sorting table area. And on the right here, it's just another view at the room, kind of from the same angle as when you saw the room empty. And now it has all these shelves in here for medication storage and also for those patients' meds that they store at HealthNet. Next up, I'll introduce Wayne to talk about our survey.
We had 11 surveys that were returned to us, and the comments and the questions that were categorized and counted, and as a result, or all the results had been returned to HealthNet. One of the questions that were asked on the survey is a pharmacy more efficient? And what came back was 77% did agree that the pharmacy is more efficient. And all the respondents either agreed or strongly agreed that that it is easier to identify medications. We also asked 2 additional open-ended questions and categorized the data regarding what the respondents liked most and least about the changes. And the most liked change was additional space and storage. And again, all the surveys were returned to HealthNet for the management to address whatever issues there were. And how can you help? You can help. As you heard, volunteers are always needed at HealthNet. I don't believe they could survive without. Donations, funding is always an issue, and it's nice to give what you can. And you can spread the word. Let other people know that are in need, that there is help out there and hope through HealthNet. And we'd like to recognize Mike Dowell, a volunteer pharmacist, and Gene Randalls, the current executive director of HealthNet. We also have brochures or newsletters to pass out. And by the door there are pens and business cards to pick up also. And are there any questions?